Hi, this is Dr. Sarah Stafford. I'm a pediatrician from Northeast Pediatrics at our Schertz office, and I was going to talk to you today about depression, particularly in our children and adolescents. Depression is a medical condition. It is both treatable and something that we can get you back to living your normal life. It is important to note that depression is not something that's in your head. It's not a lack of normal character. It's not a weakness or anything. It's something that we actually have a diagnosis of. There are signs, there are symptoms, and there is medical treatment. It's not something you have to suffer through alone. The definition of depression is at least 2-week span or longer of feeling down or depressed for most of the day, most days. In children, it can also present as just feeling very irritable for most days. This is something that you can notice in yourself or that other people can notice about you. It can also present as just a complete loss of interest in things that used to make you very happy. For example, if you're an athlete who used to love going to baseball practice, you don't any longer enjoy going to baseball practice. Or an artist who used to love to draw every day might not necessarily like to draw anymore. But it's most days for at least 2 weeks. The signs and symptoms of depression that you can look for in yourself and loved ones that can differentiate depression from just feeling down are, besides the depressed mood for 2 weeks or the loss of interest in your regular activities, can include fatigue, a difficulty getting out of bed in the morning, change in sleep pattern, which can include increased sleep or decrease in sleep and insomnia. You can feel like you're moving through a fog, or you have difficulty moving your arms and legs, a slowness of movement. You can have a change in appetite, either where you eat more or you eat less. You can have difficulty concentrating or focusing at work or in school. You can have a feeling of guilt or as if you don't matter to yourself or to the people around you. And the most noticeable, of course, is that you can have a desire to hurt yourself or to take your own life. Treatment options for depression are much like treatment options for other medical conditions. For example, in diabetes, sometimes we offer options for lifestyle modifications like diet and exercise. For depression, we offer lifestyle modifications like counseling or learning coping strategies. When it gets beyond that, we offer, like other medical conditions, medications, and that's when we would either take care of you here in the office or send you to see a psychiatrist. These medications come with side effects, and we would talk to you about it if it ever got to that point. An important thing to note about depression is that when left untreated, whether you need lifestyle modifications or medication, depression can be a fatal illness. So it's very important to seek help if any of the above things that we talked about sound like you or someone you care about. Thanks for your interest in everything that I talked to you about today. We'd be happy to talk to you here at our office about any questions or concerns you might have. I'm also going to include some links to some good places to go look if you have other questions, both in this presentation, and there's some links going to be attached at our website. Really important thing to remember is you do not have to go through this by yourself. There are people in your life and there are people all around, particularly at medical offices, that are trained to help you get through these kinds of situations. So just ask for help. You don't have to go through this alone.